Good morning, ladies and gentlemen. Today we'll talk about a new topic. Its title is Assess, Classify, and Treat and Follow Up and Counsel for Acute Malnutrition in the age group between 2 months until 5 years of age. As we all know that the objective of our content is to assess and to classify the sick child complaining of acute malnutrition and treat the child complaining of acute malnutrition, counsel the mother for acute malnutrition and give specific recommendations for food supplementation and give follow-up care for acute malnutrition. This is the main objectives of these presentations. As we all know that the integrated management of newborn and childhood illness have 4 steps. One of the things, firstly, is assess and classify the sick child, then treat the child, counsel the mother, and give follow-up cares. It is important to have an overview picture of how to deal and manage the complaint of acute malnutrition child. Firstly, after the nurse after the reception, the child and the caregivers go to the triage site where the triage nurse check the child for general danger signs. And I just want to remind you about it again. It's the child is not able to drink or breastfeed, the child vomiting everything, the child has had a convulsion or is convulsing now, and the child is lethargic or unconscious. If have one of these general danger signs, the child recognized and classified as a very severe disease and should be referred to the triage, to the treatment room, where should be managed promptly and give quick assessment and given peripheral medications, preventing low blood sugars, warming the child, and refer urgently to the hospital. Otherwise, if the child didn't have any general danger signs, should looking for specific complaints like in acute malnutrition, looking for an edema of both feet. Edema of both feet is usually red flags for children. Most of the time, either be a sign of acute malnutrition or other most common causes, nephrotic syndrome. Either one should be referred urgently to the hospital for further management. Edema in both feet, it can be seen in acute malnutrition, especially who have a kwashiorkor from the severe malnutrition, and it's only an interstitial fluid entrapment due to low proteins. As seen in this picture, so you just betting the dorsum of both feet for 5 seconds and then look for if there is a pitting edema or not. And as seen in these pictures, it's very clear that this child have a clear edema in both feet, pitting edema. After that, we should assess the mid-upper arm circumference. If it's the measurement is below 115 millimeters, that is categorized as a red color of the tape, and it's in the red zone, and it's one of the alarming for severe malnutrition. The other reading, if it's between 115 and 124, and that means it's in a yellow color, as seen in these pictures, and that indicates a moderate malnutrition. Otherwise, if it's more than 125 millimeters, it's a green zone, and that is the child doesn't have any malnutrition. You can assess further if it's have a time by measuring weight for scale, weight for age, and weight for height. Weight for height and looking for height or length, and it's below -3 z scores or not. So if it's below -3 Z scores, we classify it as severe malnutrition. If it's between -2 and -3, that means the child is in moderate. If it's above -2, it is have no malnutrition. As I mentioned before, if you have one of general or specific danger signs, should be child referred to the treatment rooms. Otherwise, we go further and we show, as you see in here, we categorize him in the treatment room as severe acute malnutrition and have give him the first dose of appropriate antibiotic and prevent from hypoglycemia, warning the child to refer urgently to the hospital. Otherwise, if the child didn't have any of these, the child can be waiting area until seen by the direct physician in the examination room. In these situations, either the child would be classified as moderate acute malnutrition or the child would be classified as no acute malnutrition. Now, this is an overview picture. Now we're going in further deep detail about acute malnutrition. Now we're talking about how to assess an acute malnutrition child. Firstly, as I mentioned before, we should looking for an edema. If there is an edema in both feet, that means the child most probably have an acute malnutrition. And it's mostly seen child with edema of both feet maybe have a kwashiorkor or another form of severe malnutrition. Edema is often usually a large amount of fluid gathering in the child tissues. The tissue become filled with the fluid and look swollen and buffy. Look and feel for determine if the child has an edema of both feet. Use your thumbs to press gently, as I mentioned before, for nearly 5 seconds on the top or dorsum of the feet. And then if there is a pitting edema, that's a sign of an edema in both feet, as seen in these pictures. So the measurement, as discussed it before, we have 3 reading levels: a red zone, yellow zone, and green zone. In the green zone, there is no malnutrition. Yellow zone, there is moderate malnutrition. In red zone, there is a severe malnutrition. Also, in addition to that, in acute malnutrition, we note that the child have the Z score weight for height or length is less than -3 Z scores, and this is classified as in this picture. So this asterisk, this reading is below -3 Z scores. So this child is considered as severe malnutrition. But another example, who are between the -3 and -2 Z scores, this child is considered as moderate malnutrition. Any child reading above -2 Z scores usually considered no acute malnutrition. We usually have what we call, this is the place between -2 and -2. -2 and +2 is the area which we prefer. Otherwise, we may have an overweight or obese child. In classifying for acute malnutrition, as we mentioned before, for classification, we have 2 categories. We have severe acute malnutrition and moderate acute malnutrition, no acute malnutrition. Just to remind you, only have the 3 categories: severe acute malnutrition, or the moderate acute malnutrition, or no acute malnutrition. So the child with the acute malnutrition and the treatment, firstly we should categorize, and according to category have a specific management. For the red zones, as we mentioned before, we give first dose of appropriate antibiotics and treat the child for preventing blood sugars, and just giving fluids and sugars and breastfeeding and giving foods to prevent low blood sugars. Keep warm the child and refer urgently to the hospitals. Otherwise, we will, in the green zone, we just praise the caregivers for what they do. But if the child is less than 2 years of old, we should assist the child's feeding and counsel the mother if there is any feeding problem, according to the feeding recommendation from the WHO IMCI program. And if there is any feeding problem, we should have a follow-up after 7 days. Otherwise, now we're more concerning about moderate acute malnutrition, where the child should be assessed for the feeding and counsel the mother about feeding recommendations. And if there is a feeding problem, we should have a fixed follow-up after 7 days. Otherwise, if there is no feeding problem, the fixed follow-up will be after 30 days. So, we counsel the mother about feeding problems. We're starting with we assisting the feeding, and by this way, we should look for the following: the type of food that the child take, and frequency and amount of food. In addition to that, we look for texture and responsiveness of feeding. And we should all correlate it with the recommendations of the feeding according to the specific age. Um, just now, I want to give you some statements that have been proved by evidence-based according to the research all over the world about breast milk benefits, and it's very important for us to have these informations and transmit it to the caregivers and mothers to encourage the mothers for breastfeeding. So we start with the milk contains an exactly nutrient needed by the infants. It contains the proteins, fat, and lactose, special milk sugars. It's a special milk sugars and vitamins like vitamin A, vitamin C, and iron, and many other vitamins. The nutrients are more easily absorbed from the breast milk than from the other milks. Breast milk also contains essential fatty acids needed for the infants growing, the brains and the eyes, the blood vessels. These fatty acids are not available in other milks. So the breast milk is also an important source of energy and nutrient in children aged between 6 months until 23 months. It can provide half of or more of the child's energy needed between the age of 6 months to 12 months, and 1/3 of the energy needed between the age of 12 months to 24 months. Breast milk is also a critical source of energy and nutrient during illness, and reduces mortality among children who are malnourished. Breast milk provides all the water the infants need, so even if hot or dry climate, breast milk protects an infant against infections. An infant cannot fight infection as well as older child or an adult. Through breast milk, an infant can share her mother's ability to fight infections. Exclusive breast milk infant are also less likely to get diarrhea and less likely to die from diarrhea or other infections. Breast milk infants are less likely to develop pneumonia, meningitis, ear infections than non-breast milk infants. Children and adolescents who are breastfed as babies are less likely to overweight or obese. Additionally, they perform a better intelligence test and have higher school tendency. Breastfeeding is associated with higher income in adult life. Improving child development and reduces health costs, reduces an economic gain for individual families as well as the national level. Breastfeed helps mothers and babies to develop close, loving relationships. Breastfeeding protects mother's health. After delivery, breastfeed helps the uterus to return to previous size, and this helps reduces the bleeding and prevent anemia. Breastfeeding also reduces the mother's risk of ovarian cancer and breast cancer. So overall, as we mentioned, that exclusive breastfeeding will give an infant the best chance to grow and stay healthy. All of these messages should be given to the mothers to promote breastfeeding, especially before delivery the baby. But we should continue to give for these messages as long as the duration of breastfeeding, which is below 24 months. And this is helping to encourage the mother for breastfeeding and continuing breastfeeding both together. Now we're going in depth in detail about recommendations for age up to, according to specific age group. We will start with the age group up to 6 months. So as we mentioned before, we should looking for three kind of questions. Type of the food and frequency, amount and texture and responsiveness of feeding. So about the type of food, it's exclusive breastfeeding. We don't give other foods or fluids. So breast milk is all the baby need. When looking to the frequency and amount, usually it's on demand. Breastfeeding as often as your child wants. Breastfed day and night over whenever your baby wants. At least 8 times in 24 hours. Frequent feeding produces more milk. So just remember this, at least 8 in 24 hours, and just give a frequent as much as the child wants because it's helping to produce more milk. Looking for signs of hunger, such as beginning to fuzz, sucking fingers, or moving lips. All of these signs can help you to know if child's hunger or not. Secondly, we're going to another age group, the age group which is recommended between 6 months up to 9 months. If we look into the types of food, we still continue breast milk, and in addition to that, we give it's now time of weaning, so we can gradually add another foods such as carrots, pumpkin, potatoes, and banana, apple, pears, dates, meat, chicken, egg yolk, or oatmeal. But usually we start with vegetables because it's not a sweetie, and we also with egg yolk and the chickens all are preferable, and gradually add others like fruits and meats and date. Date is very good because have many nutrients like phosphorus, which is very important as a source as an energy. And about the frequency and amount, breastfeeding as often as the child wants, and in addition to that, we should give other 2 to 3 times daily the foods, starting by giving 2 to 3 teaspoons and increasing gradually. So you don't need to give a large amount of food, just give small amounts and increasing with time. About the texture and responsiveness of the child, you should think that it should be thick porridge or mashed food. So it should not be too much like a juice. We need it to be a mashed, thick one. If your child refuses a new food, offer tastes several times, show that you like the food and be patient with the child. Most of the time, they are trying to be picky. So just help the child to know that it's good food. And don't try to mix all the things together. Just give one kind of food and look to the child's response, and then look for another. In the age group, which will be between 9 months and up to 12 months, we still continue to give the breast milk. But in addition to that, we have many varieties of vegetable and fruits such as carrot, pumpkin, potato, banana, apple, pears, dates, meat, and chicken, egg, yolk, still continue, and oatmeal. And all of these should be now more matured for the child and have a good experience about taste, and you know your child which kind of food is more preferable. So in the frequency and amount of breastfeeding as often as your child wants. In addition to that, we give fixed 3 meals each day. In addition to that, we give two snacks between meals. The child will eat if hungry. Let your child try to eat a snake, but provide help if needed. Increase gradually from half a cup to 3/4 of the cup each meal, and the cup measurement about 250 ml. In a kind of texture and responsiveness of feeding, the texture should be mashed or finely chopped foods. For snacks, give small, showable items that the child can pick and eat, like vegetables and potatoes, and even cheese. All of these can be helpful to be picked and eaten, and even fruits. Let your child try to eat the snake, but provide help if needed. In the age group between 12 months until up to 2 years of age, we still, in the type of food, continue breastfeeding. Also, we give a variety of foods, including meat, chicken, fish. Now we can introduce in fish, whole egg. We can give an whole egg in vegetables, fruits such as carrots, pumpkin, potatoes, banana, apples, pears, dates. Pasta, we can add pasta and honeys. All of these we can add it in the age above 1 year. About the frequency and amount, still the breastfeed as often as the child wants. In addition to that, we have still continue having 3 meals each day and offers 2 snacks between the meals. About the amount, it should be at least 1 cup each meal from 15 months, at least 1 cup. So you can add more. In the texture, it should be mashed or chopped food, still as the same. Continue to feed your child slowly and patiently. And in response to the child, we should encourage but don't enforce the child for eating. In addition to that, now we go to recommendations in the age group 2 years or older. So we give a variety of family foods, including meats, chicken, fishes, a whole egg, vegetable fruits such as potato, heat the foods of the family. Just we should enforce about variety of foods between vegetables, meats, and fruits. In addition to that, looking to the carbohydrate levels like potato, about the kind of protein, I preferably use in eggs. It's very good protein. Now we go to the frequency and demand. We give 3 meals each day and offers 2 snacks between meals. Give at least 1 cup at each meal, so you can give more if the child wants. Texture and responsiveness of feeding, texture as a family member, so there is no variety. And take with your child during the meals and keep eye on contact. So let him eat by himself or herself. I just want to remind you, in addition to the differences from the feeding recommendations, there is other some problems maybe become apparent from the mother's answers. For example, there is difficult breastfeeding or use of bottle feeding or lack of responsiveness, responsive feeding or not feeding well during instances. All of these problems are usually present, and you should be recognized by the physician and try to solve these issues. For example, when looking to the difficulty breastfeeding, the mother may mention that the breastfeeding is uncomfortable for her, or that the child seems to have difficulty breastfeeding. If so, you will need to assess breastfeeding, and that means you should looking for the position as and attachment in addition to suckling. And you can improve both. If you can improve these position, attachment, and suckling, at the end you will improve the breastfeeding. But you should look more to the other pathologies maybe seen in the nipple, like nipple cracks or soreness, and you can treat these things to help the mother to continue breastfeeding. About the other issues, which is a very common seen in practice, is the child using the bottle feeding. So feeding with the bottle shouldn't be used, as we know this often catching dirt and germs easily. And the fluid tend to be left there inside the bottles will be spoiled easily and soreness. The child should be drinking, may drink spoiled fluid, and that will lead to an illnesses. If we looking to another complaint, lacking of responsiveness of feeding. Young children often need to be encouraged and assisted to eat. This is especially true if the child has a very low weight. If a young child is left to feed himself, or if he has to compete with the sibling for food, he may not get enough to eat. By asking who fed the child and how, you should be able to find out if the child is actively being encouraged to eat or not. Most of the time, we recommend the child to eat separately, away from the sibling, and we advise the caregiver or the mother to be with the child at the time of feeding to to look for his feeding and assist him in feeding. All of this very important. Not feeding well during illness. The child may be eating much less or eating different foods during illness. Children often lose their appetite during illnesses. However, they should be still encouraged to eat the type of food recommended for their age, as often as recommended. Even if they don't eat much, they should be offered their favorite nutrient foods, if possible, to encourage eating. And it's very important. You should the caregiver in this duration should be more patient. Now we go to the follow-up care for acute malnutrition. As I mentioned before, if there is any feeding problems, you should have a fixed follow-up after 7 days. And then we should reassess the feeding, ask about any feeding problems found in the initial visit, counsel the mother about any new or continued feeding problems. If you counsel the mother to make significant change in feeding, ask her to bring the child back again. If the child is classified as moderate acute malnutrition, ask the mother to return after 30 days. After the initial visit to measure the child weight for height or length or mid-arm circumferences. So after 30 days, we should then assess the child using the same measurement which have in initial visits and compare if the child weight for age, weight for height or length, measurement determined and mid-arm circumference also measured, then check if there is any edema in both feet or not, and then reassess feeding. So all of this, if it's good, then we look if the child is no longer classified as moderate acute malnutrition, praise the caregiver and encourage her to continue. Otherwise, if the child is still classified as moderate acute malnutrition, counsel the mother about any feeding problems found and ask the mother to return again in 1 month. Continue to see the child monthly until the child is feeding well and gain weight regularly, or his weight for height or length is above a -2 z scores, or the mid-arm circumference is above 125 millimeters. But there's some exceptions. As we know, if at the time of follow-up you feel that or you think that the feeding will not improve or the child has lost weight or they mentioned mid-arm circumference, and then it's preferable to refer the child to the hospital for further management. Now we go into the counsel the mother for acute malnutrition. We think about safety net is very important. In moderate acute malnutrition, we should tell the caregiver or the mother about when to return immediately. And most of the time, if there is any general danger signs or develop a fever or become sicker. In home care, we just, as I mentioned before, we advise for breastfeed more frequent and for longer incubation for each fed. In addition to that, we recommend feeding according to specific age group for IMCI program. As a promotion, if it's appropriate, we advise the mother for the next well-child visits and immunization, if appropriately. Otherwise, we should concern more about hand hygiene. Most of the time, recurrent infections from improper hand hygiene, so we should promote hand hygiene. And also, we should recommend breastfeeding if it's proper according to the child's age. Breastfeeding recommendation, as all the messages which is given at the time of gestation, should be given regularly to promote breastfeeding and continuing breastfeeding. Otherwise, we should more promoting for proper feeding according to the age, and all of these should be done in a frequent way according to an active way, not in passively. Try to share the caregivers all of these messages that will help her to be more confident to um, help her child. Thanks for participation. I hope all of you are taken this presentation as 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 one that we need to be encouraged to know, and is one of the presentation for malnutrition. And I mentioned in the last presentation about anemia, which is one of also of the nutritional problems. Thank you, and we'll see each other in next presentations.